this is Dr. Russell Foulk. I'm at the Nevada Center for Reproductive Medicine. And today's subject is on one of the more sophisticated areas of medicine that we do in reproductive medicine, and that is third-party reproduction. Specifically, it has to do with gestational carriers and surrogates. So let me define what those two things are. A surrogate is an individual who donates their egg and their uterus to the creation of a baby. A gestational carrier is an individual who just donates the services to carry the baby, not her egg. So a lot of people confuse the two. We typically use gestational carriers. Surrogates are not used anymore just because of the risk of having two components involved in that pregnancy. Whereas gestational carriers are individuals who help a couple have a child through the use of carrying their baby for them. So why do people do this? The reason why a gestational carrier is needed is because the couple that want to have a child for some reason can't because the woman's uterus is no longer healthy. So for example, if a woman had a hysterectomy for a cancer or a disease that has damaged her uterus or a medical condition where she's unable to become pregnant, then she needs someone else to carry that baby for her. In that situation, what we do is we create the embryos through in vitro fertilization using the intended father's sperm and the intended mother's eggs, create the embryos, and then we need a place to put them. And so a gestational carrier comes in, and they're the most wonderful people in the world that offer to do this. And we get their uterus ready and put the embryo into that person's uterus. She then carries that for 9 months, and after a normal, healthy pregnancy, will deliver the baby, and the baby goes back to the intended parents. So as you can see, it's a very sophisticated treatment because you're combining several different high-tech treatments through a coordinated effort in order to create this baby for this couple. The screening for the gestational carrier consists of making sure she is healthy, her uterus is healthy, she's had a successful pregnancy before, and then the screening on the patient side is making sure that they're comfortable with the idea of having someone else babysit their baby for 9 months and not participate in the creation of that baby through their womb. But the beautiful thing about it is the joy of creating this child through a third-party construct, so that now instead of just the couple that would otherwise never be able to have a baby, they can now do it with the assistance of another wonderful human being. It's a very specific area of our field, but as you can imagine, it's one of the most beautiful experiences that you can be involved in because of the involvement of more than just the patients that will eventually end up as parents. So a common question we get is, how do you know at what point you need a gestational carrier? And the answer usually is pretty self-evident once you go through treatments. If, for example, you've had a hysterectomy, obviously you're going to need someone that helps you carry that. But in a situation where a woman has tried multiple times and perhaps has miscarried many times and you don't have an explanation for those miscarriages, that's when you need to explore the option of using a gestational carrier. We have some individuals who have heard about just being a gestational carrier and are wondering, how do you do that and what does it involve? It's actually quite simple. I mean, the hardest part, of course, is the pregnancy, but a lot of individuals love to be pregnant. What is done is this initial screening period that takes about a month or two, and then a matching of the couple that will eventually serve as the parents, which means developing a relationship with this couple so that there's a trusting relationship and a good sense between you that you'll be able to do what's best for each other. If you are interested in becoming a gestational carrier, or if you're a patient that might have need for that, please give our office a call at the Nevada Center for Reproductive Medicine, and we'll be happy to help you navigate through that very exciting field.